Welcome to this e-learning module about FASD key workers. My name is Sima Fuster, and I'm one of the teacher consultants for the Provincial Outreach Program for Fetal Alcohol Spectrum Disorder, otherwise known as POPFAST. In our work with educators around the province, we're often asked about what services might be available beyond school for students with FASD and their families. Today we're talking with Anne Fuller, who is going to explain a little bit about the Key Worker program for us. Anne, thanks for being with us today. And would you like to start by telling us about your role?
Sure, and thank you very much for the opportunity to talk a bit about the Key Worker program today. So I work in Victoria for the Ministry of Children and Family Development as the provincial FASD consultant for the ministry.
And what exactly is the FASD Key Worker program?
Well, the ministry developed the Key Worker program in 2006, and it was developed in response to the need that was expressed by parents and service providers for families to have support in raising their children who have FASD. Key workers work directly with parents to help them better understand their child's specific disabilities, and they help the parents develop and put in place effective parenting strategies and to really become the best advocates for their own children. They also work with service providers such as schools and other community groups to put in place effective strategies as well in the community that can support the child. And they also can be involved in establishing and sometimes facilitating parent groups or caregiver support groups as well.
Some people think that the Key Worker program is just for foster parents. Is that true?
Actually, no. The Key Worker program is available to any family that is raising a child from birth to age 19 who has FASD. So that certainly includes birth families, adoptive, foster families, and also relatives. We have a lot of grandparents that use the service, aunts, uncles, you know, a family is a family. So the Key Worker program is certainly available to them.
How can a family access the program?
The family can certainly make a self-referral to a Key Worker agency and indicate that they feel that this is a program that they would find supportive. They could also be in touch to a Key Worker through a community agency such as a school or one of the assessment networks. Any community agency could make the referral.
So does a child have to have a diagnosis of FASD for this service?
No, the family can self-refer to the Key Worker program without a diagnosis or at any point during the assessment process. Now that said, Key Workers certainly work with families to help them understand the benefits of seeking a multidisciplinary assessment through the CDBC networks, because really it's those assessment reports that really help everyone that's around that child better understand the child's challenges but also their strengths, so that the strategies can be really effective in supporting that child. Now, sometimes a child who is assessed by the network might not end up with a confirmed FASD diagnosis. And sometimes that happens because, for example, prenatal alcohol exposure perhaps was not confirmed during the whole intake process. And so, according to the Canadian guidelines, the FASD diagnosis is not confirmed, but the assessment team may still feel that that child's challenges are so similar to FASD that a Key Worker would be appropriate and helpful. So they would discuss that with the family.
So are these services available everywhere in BC? What about on reserves?
Well, each of the ministry's 4 regions have developed contracts with their community agencies to deliver Key Worker programs. And what that looks like is going to vary from community to community. There are certainly Aboriginal service providers as well, and service agencies that do provide Key Worker services both on and off reserve.
Great. And it's so wonderful for you to be able to explain this kind of service for us, and having a service like this that we can recommend is really helpful for people out there. The next part of the module that we're going to show is a clip that we've done with a Key Worker who is going to tell us more about the work that she does with families. But before we do that, Anne, is there anything else that you want to tell us in particular about the program?
Well, it's certainly been a very successful program. It's unique. It is the first province-wide program of its kind that provides support directly for families who are raising kids with FASD. And we've certainly heard from many, many parents that it has made a big difference in their approach with their child, but also has helped them build confidence in their parenting. But we've also heard from schools and other service providers that key workers have become a really important part in their community partnerships in helping families. And I've also certainly heard from many, many key workers that they highly value the relationship that they have with their school partner. So again, thank you very much for the opportunity today.
Thanks for being with us.
I'm Roxanne Hughes. I'm an FASD key worker. I work with Pacific Community Resources Society in Surrey, BC. I've been a key worker for the past 6 years since the beginning of the Key Worker program. It's a really neat program. We're able to work with families who are parenting children and youth who have an FASD diagnosis or are suspected of having FASD. These kids have an invisible disability. You can't see it by looking at them, but you sure get to see some unwelcome behaviors. So our parents get the opportunity to vent to someone who understands the disability, who doesn't judge them around their parenting style, and actually takes the opportunity to really emphasize how the parents have really already made huge accommodations for their child, and we just get to tinker a little bit here and there. We find that families come to us with a range of advocacy skills. Some are very strong advocates because they've grown accustomed to speaking for their child and trying to get services for them, and others are much more timid or uncomfortable with that. We work with the family from where they're at, and we help them to develop their skills around advocating for themselves and their child or youth, but we also help them to develop the skills. Years ago, I was working with a kid who we were having integrated case management meetings on a monthly basis. And at the beginning meetings, I was chairing and organizing the meetings. And as we progressed, she took over the chairing because she just became so confident around her self-advocacy. It was pretty darn exciting. In order to know if a child actually has an FASD, they need to go through a very comprehensive assessment process where they're met by a team of specialists who look at different areas of the child or youth's functioning. One of the ways key workers support this process is by helping families to fill out the necessary paperwork, to gather the forms and assessments that have already been done that are necessary for the assessment team to do a thorough assessment. Key workers are often able to drive families to assessment appointments if transportation is a barrier for the family. And we also really enjoy participating in the diagnostic meeting, which happens at the end of the assessment. The diagnostic meeting is typically a very overwhelming meeting for families because it's the time where they hear about the assessment findings and the areas of strength and challenge for the child. It also includes what diagnosis the child is given at the end of the meeting. What we find is our families typically are quite overwhelmed and don't remember everything that happens in that process. Key workers are able to take notes that they share with the families. They're able to interpret the results. They're able to ask the assessment team questions and assist with follow-up on the recommendations that the assessment team makes. The diagnostic report often follows that meeting by several months, so it can be quite some time between when the family hears verbally what their child's area of strength and challenge are and what they get in paperwork. So it's really positive for us to be involved in that meeting. One of the great things about the key worker job is that we get to work with the child or the youth school around planning and collaborating around meeting the child's needs most effectively. one of the things we like to do is to participate in meetings like integrated case management meetings. Often we're invited to safety plan meetings for a kid, and just team meetings to help the team to more effectively understand the child's diagnosis within the context of an FASD and their brain functioning, and to help the team to create and brainstorm accommodations that can be made that might be more effective for managing the child in the classroom. So classrooms are busy places, and when you add a child with an FASD, it's quite challenging. Another thing that we get to do is offer training to educators and administrators, really anyone. It's a really neat part. We like to come to Pro D days, are a great time. I've been often invited to staff meetings where we spend an hour or two working with the staff team that's supporting a child to help them understand FASD in general terms, and then more specifically how it applies to the child or children that they're working with. We can also act as consultants. We often get teachers or educators phoning us saying, we're really having a challenge with this child, and we're wondering if you can help us come up with some strategies to more effectively work with them. So it doesn't even have to be a file that we have open on our caseload. They can just call us, and we call it pick our brains. We have found that with an FASD, transitioning is an area of huge challenge. And a transition is changing from one activity to the next on a very small level, or changing from one school to the next on a very, very large level. Transitioning from elementary to high school is even more difficult, because you see a child going from a very small, secure elementary school setting where they have one, maybe two teachers, but you know, everybody's doing the same thing at the same time. So it's much easier to follow around and follow along. When you move into a high school setting, we now have youth coming and going into different classrooms. The hallways are very busy and active places. It's very confusing and overwhelming for any grade 8 student, let alone a student with a brain-based disability. When kids move into adulthood, that's a very frightening time for everyone involved. There are a very limited number of services available to our young adults with FASD. The majority of people with an FASD diagnosis have an IQ of above 70. So that means they're not eligible for community living services. Fortunately, Community Living has come up with a new program called Personalized Supports Initiative. PSI is their initials. And that program is available for adults who have an FASD diagnosis, an IQ of above 70, but an adaptive functioning of 55 or lower. And that's quite low adaptive functioning. So it really only captures a small population of those with an FASD diagnosis. We help with the process of applying for PWD, Persons with Disabilities Income Assistance. Typically with an FASD diagnosis, the person is eligible. It's just a huge form and process that we have to go through. If the youth is eligible or possibly eligible for Community Living BC supports, we will help with that process. We'll attend transition meetings so that as the youth is moving between 18 to 19, we can help support that process and help communicate what this person's going to need into adulthood. But the transition into adulthood is a difficult one because there's little to transition to. One of the really neat things about being a key worker is when people get it. They understand that this is an invisible brain-based disability, that the child or youth is not behaving this way on purpose, is not trying to upset you, is not trying to create chaos, but is communicating that they're really struggling with what's going on. And when we work with people and they have that moment of insight that really changes the way they interact with the child and changes their commitment to the child, it's pretty exciting work.